What it does is, remember, these molecules are held together by cross links, and they can't form in the presence of these anti-inflammatories. And so now you've got all these individual fibers, instead of being linked together in a nice mesh, they're not. They're sitting there strands individually. So it absolutely devastates the quality of the scar tissue. You got crappy scar tissue, you just made it crappier. So we really want to avoid anti-inflammatories. Now, this does not apply to natural anti-inflammatories. So if they did have some ongoing inflammation and you gave them your little cocktail with bromelain and turmeric and all those other ginger, those have no negative side effects. So they're not as powerful. I can take an Advil, and often Advil works better than Arnica, but Arnica has no side effects, and probably is beneficial to it, whereas the Advil is actually weakening. And now I go from 80% down to 60% simply because I took those medications. Okay?
Right. Okay.
Now, your job is control inflammation, increase the strength of our repair response without producing excessive scar tissue. And what else am I missing? Control pain, trigger point injections, things like that. What else am I missing? What else is the PRP going to do to that area other than supercharge what we're already trying to do? PRP tends to have none of the negative side effects, but it just simply enhances our ability to straighten out the nerve, the fibroblasts in the area.
Yeah, I think it definitely helps recruit more of those growth factors to the area just by the death of those platelets or the opening up of those platelets. It also seems to have some sort of an anti-inflammatory effect all on its own. And I don't know if that's because it's dilutional.
I was going to say, I don't know why it has that. It does have an anti-inflammatory effect. And what's funny is, like 10% of the time, it does actually have a pro-inflammatory effect. And I'm not sure why either. So if you can explain that, you need to have answers to those questions. And you need to be able to explain to a patient, here's what's happening, and here's why you need the PRP. The poor blood supply means the body doesn't grow new blood vessels to this area. If we inject you with PRP, the body adds more blood vessels to the area, and it adds more fibroblasts to the area. And those fibroblasts work more effectively and more efficiently in the presence of growth hormones.
Right.
So not.
Look at the camera, not me.
Oh, thanks. And that's what you want to be able to communicate. And if you can't communicate that, the patients are going to reject your recommendations.
Right.
So we'll talk about how to get better recommendations. But basically, the formula is really simple. Explain what's wrong. You have a torn ligament. Torn ligaments have these limitations as they heal. They're not strong, they're not flexible because of the poor collagen formation. We can rehab those joints. That's why you went to physical therapy. They did the right thing. They stretched you, but your doctor gave you anti-inflammatory meds. He shouldn't have done that. That's counter-effective. Here's why. Now we have to turn this whole process back on again because all this happened 6 months ago. The typical patient that comes into our office, they already went to their MD. It's been 6 months. They spent $5,000 on physical therapy and drugs, and it hasn't worked. And now they're coming to us, and your biggest selling point, Chris, is to look them in the eye and go, can you see why? If your doctor gave you drugs and he messed up all the crosslinks, if you waited 3 months to do physical therapy and they weren't aggressive enough, they didn't straighten out your fibers. And now it's my job. I got to restart the healing process. Your body's already given up on this joint, and I have to take your growth hormones and inject them into this area. Otherwise, your body thinks this is a done game. This is the way it's going to lead it the rest of your life. I have to intervene. I have to kickstart it.
We're changing what normal is in that healing process is kind of what I'm hearing. So what normal has been created inside of that joint that your body now recognizes isn't where you want to be. And so we want to help you get there and preserve your native tissue. And one of the best ways to do that is through regenerative medicine. And regenerative medicine includes PRP, and PRP delivers a lot of those same products that your body makes naturally to an area that doesn't get it very well from the body itself because of the limitations of blood flow, which is why it's trying to create more blood flow to the area. And so we're just kind of taking a little bit of a shortcut here and just delivering your body's own medicine into the joint to help reinitiate that healing process so that we can have some new scar tissue to work with, to rehab, that's not been, I don't want to use the word tainted, but that's the first word that comes to mind, by the process that you've already been through. So
That's exactly it. And that was a brilliant, I mean, that was a super awesome explanation for a medical professional. We've got to practice how to communicate that to, like I said, to a 10-year-old, to a 12-year-old, to a housewife who never studied medicine before. And we do that by, anyway, that's what we're going to practice, is that communication to where it's so simple and clean. And they have to realize we're their only option, or we're their best option, and why they went wrong. What did my physical therapist do wrong? What did my doctor do wrong? You have to be able to explain that without saying, well, here's how they screwed up. You have to say it politely. So anyway, I think you've got it. Any questions about this?
I'm feeling pretty good.
Good. I want to cover real fast the remodel stage. Because remember now, the remodel stage, it starts at the 3-week mark.
Pardon me.
And it kicks in at the 3-week mark. It starts at that's 3 weeks, and it kicks in at 3 weeks, and it peaks at about 1 to 3 months, and then it fades. And the minimum is 6 months. It's at least 6 months, but it usually lasts about 2 years. Now remember, 70% of the healing occurred. Your body is very metabolically active in the repair stage. At that 3-week mark especially, your body is cranking it out. The remodel stage, that means you're only getting 30% of the healing in the remodel stage. And that's not very much. But the thing to remember too is most of the remodel stage is in the first 3 months. So even though, yes, it could take 2 years to fully heal, the first 3 months, I mean, it's fading. By the end of that 2-year period, it's healing at like 0.1% a week or something like that. It's ridiculously slow. And that's assuming there is no re-injuries. If you're re-injured at any point, you re-begin the whole process to some degree. So you've got to realize that inside this tear, there's going to be pockets of inflammation. There's going to be type 3 collagen being produced, and there's going to be type 1 collagen being produced. Oh, because the primary characteristic of the remodel phase is your body building type 1 collagen again.
Right.
And it actually is converting the type 3 collagen into type 1. Now, what's the advantage of type 1 collagen?
Well, it's stronger.
Yeah, you're just trying to get that 30% boost in strength.
Right.
What's the downside of type 1 collagen?
I can't really think of a downside to type 1 collagen.
There is. And the problem with it is when your body goes in and replaces this piece of type 3 collagen, it follows the same shape. So if you've got tangled type 1 collagen and your body replaces it with tangled type 3 collagen, type 1 collagen does not respond to stretching stimulation anywhere near as good as type 3. So if you have waited 6 months or a year and your body has replaced all this crappy type 3 collagen that you didn't rehab with type 1, you now have a permanent condition.
Yeah,
that's why with a frozen shoulder, guess what the main solution to the frozen shoulder is? You can't just go in there. In other words, the body made a whole bunch of type 3 collagen. They let it adhere to the tissue around it. And then your body turned all that type 3 into type 1. So even if you rehab a frozen shoulder, you get really crappy results, right?
Oh, yeah.
So what do?
A lot of it's just physical therapy, acupuncture. These are the things I've seen work.
I was always told the main way is you hold the guy down and have 3 orderlies grab his arm and rip it all apart.
I mean, you can put them. Yeah, I've also heard the orthopedic surgeons say they can do I'll use quotation marks, an adjustment.
Yeah.
On a fibrotic joint. They threatened to do that to my knee actually when I didn't get full range of motion back, so that I know it's pretty painful.
Yeah, well, it's horribly painful because it's got 10 times more nerves in it than it had before, and they're